Okay, we've got people attending here, Kath. Hi, everyone. Thanks for attending and joining us today. While we're just waiting, we'll just have a few technical issues to start with. If I could get anyone in the chat or the QA, just let us know who already is using Patientcare at this present moment. That would be fantastic. And even let us know where you're from too, which state you're coming from. That would be good as well if you can let us know what's going on. Okay, and we don't have the raise the hand feature in this webinar today. So if you've got any questions, you can just put it into the chat or the Q&A. We'll have a look at that question there for you. Because we've sort of got you guys all in listening mode. And the way to communicate with Kath and I today will be through the chat and the Q&A. Otherwise, we have too many voices happening. And, you know, and I'd probably get too involved in your conversations and get totally off track. So we need to keep me on track to go there. So, okay, thanks, Isabel. It looks like the chat's disabled. So at the moment, if you just can put it in the Q&A, well, I figured that one out for the chat, and then I will pass you over to Kath now. We'll get this webinar started, and I'll pass you over to our lovely Kath while I figure out the chat situation for us.
Thanks, Linda. I'll leave that to you for now. So we've got Jim from Melbourne, Katrina from Queensland, an anonymous attendee from WA, very mysterious there. We're going to kick off now. We've got a little bit of content to get through, but it's going to be open to questions throughout. So if you have a question, you don't need to wait to the end. Throw it in the chat or the Q&A as soon as Linda gets the chat going, and we'll bring them up as they come up throughout the webinar and have a chat about them and the answers there with you. My name is Kath Lewis. I am a product manager at Centaur, and I'm working with Linda today, who is our product specialist of Patientcare. And we're going to go through a couple of different things around how Patientcare works for those of you that aren't Patientcare users currently. But then we're going to dive straight into how, if you are using it, how you can get the most out of it and maximize those results, and share what some of our current practices are doing and then what we've noticed they're doing to get the best out of patient care and those top performing practices. So if looks like the chat is working, wonderful. If you can just also, while we kick off, pop into the chat if you are a patient care user. We do have that recorded, but just to share with everyone here today who is a patient care user, who's new to it, who's looking to find out more, and we will kick on. All right, so the first thing I'm going to answer is, because I know we have some people here that aren't patient care users, fantastic, what it is. What is patient care, Linda? So currently patient care is Australia's only, but it's also Australia's first automated patient engagement platform. And what it does is it enables our practices to deliver a superior patient experience to everyone else in the market, because we're extending the patient journey beyond the chair and beyond the practice, extending the patient experience also. So patient care helps us increase patient retention. It boosts the number of online reviews and the quality of those reviews that you receive. And it does that by guaranteeing that you are able to follow up with every patient after every appointment. And we're going to talk about why that's important and why the research behind how patient care is set up and works is delivering results. So, Linda, can you please start by taking us through what do patients see, and what do our practices have to do, the minimum amount that they do have to do with this automated system, and how it works?
Certainly, Kath. So it is a very simple process, and the name of it, patient care, so is a giveaway. We really want to see how the patient is feeling after appointment. So that's the initial contact we'll have with our patients, and that will be through an SMS, which is usually the default. But if a patient doesn't have a mobile, then there's the email that we can just send a quick little survey for them just to answer a few little questions to see how they were feeling after their appointment. So, and what we do is we send it the day after. We're not sending it an hour after. We're sending the next day when they're relaxed. They're not anxious about seeing us or anxious about having just seen us. The anesthetic is worn off. Very great time to touch base with them to see how they are generally feeling after the appointment. And it's meant to be sent to every single patient. So at the moment, historically, we're just sending it as we just call up people that we think we need to follow up. This goes to every single person, regardless of whether they have a checkup or clean. And people go, but I don't need to send it for a checkup and clean. Reason is you don't know what their experience was during your checkup and clean. These, they could have had someone sucking their cheek all day with the evacuator and they didn't feel very comfortable, but you didn't experience it. So those little things you need to sort of nip it. So that's where the aftercare message, we're finding out how they feel and how we will progress with that. And we can go next stage, Kath. Kath's my operator today with
I've got control.
She's got control. I've got to go. So with that, then, when a patient responds to that few questions, and I have to stress, we only give them a few questions. We're not giving them a 20-page survey to answer, because are they going to answer it? Know me, you get past the first two questions and I go, oh, God, more, I don't want to do it. You've got quick little questions, then they're going to respond to them. So the patients that will respond, you will be alerted by an email to say you've got some alerts on your patient care platform. Even within that email, you can click on a button that will just take you straight to the patient care platform for you to log in, quickly look at those alerts. And they'll be there. Will be any questions that you have that you can then either respond back with an SMS to the patient, or if you feel like it requires you getting on the phone to the patient, you can then make that communication and say, look, I think this might be better if we discuss it over the phone. Are you free now for me to talk to you? So that way, they're expecting the call, more likely to pick it up. As we all know, if you're bringing up your patients every day, they're not always picking up the phone. So you're very quick and easy. You're not spending hours responding. We have put in what we call suggested replies, so that makes it a lot easier. So if someone's just sent you lovely feedback, we've got a lovely just thank you for the feedback. So it reduces the time, not spending hours responding to patients' messages, but because we've made it very quick and simple for you. Okay, next one, Kath. So patient satisfaction. So this is like, we ask them how they're feeling. Next thing is, how did we go? How did we perform? So we ask for the feedback. Once again, very simple question. But we've also discovered by actually asking a patient how they were feeling after an appointment, there's 3 times more chances or likelihood of them actually responding and giving you some feedback. And the feedback, like again, is very, very simple. In our feedback, we do ask you feedback on the dentist that did the appointment. And I have had the question asked, could I have it say, oh, the whole practice? And unfortunately, we can't change it individually. And we have now discovered through research that it's actually better to ask how a particular dentist performed, because their likelihood of actually scoring you a better score is higher, and their responses are going to be better than just saying, oh, can you just give us feedback on how the team worked? If you actually link it to the dentist, they're more likely will give you feedback. And in those, a lot of times they will actually tell you how great your team are as well. So that's the feedback that we have. Next one, Kath.
Fantastic. Our last step.
Okay, so with this one then, obviously this is the cherry on top that you all guys want to know. Because like I said, the program is called Patient Care, so we're looking after patient care. So the cherry on top is that if a patient has given you some good feedback, we then prompt them to do you a Google review. And we've set it up in such a way that we do have the option of actually just sending the Google review link to those people who scored you really well. And that is usually if they score you a 9 or a 10 out of 10, we will prompt them a link to go and do the Google review. Now, we're not controlling of who does a Google review, because anyone can go and do a Google review. But all we're doing here is making it easier for those ones that scored you well. If you wanted to, we can have it set up that everybody gets a Google review after their feedback, regard whether it's good, bad, or indifferent. So you could have that option there. But we really recommend only basically sending it to those ones who just score like a 9 or a 10, because then if you've got a negative feedback, You've got time then to action that. Get on the phone and try and sweet talk them to convert them, that they're not thinking about doing a negative Google review. That hopefully you convert them, and then you could convert that into a positive Google review. So that one is fine for there. And I think we've got one last one there, Kath. Option that we have available now with Patientcare is the booking link. So this is an option that we have, and we actually strongly recommend having this. It doesn't hurt not to have it. I know everyone's aim when a patient walks out the door is that they have got an appointment already. So our biggest goal is like get them one to pay their bill, obviously, and then book their next appointment. So we've got that continued revenue coming through. But sometimes it's just impossible, and they're running late for a meeting and say, "Oh, I'll call you back." We know once they walk out their door, they're forgetting about us. We're not their priority anymore. They're not going to remember to do that booking. So what we do with the Patientcare, we do have the option where it's just say, we just reminder, have you got your next appointment booked? And it's just a multiple choice. And they'll say, yes, I've got it booked. No, I don't want to do it yet. Can you call me? Or we can even link it to your online booking line. Bookings that you can then they can go and book it online for that appointment. So you're prompting them to do that appointment. So even if you get one person making an appointment, that's a great achievement, because there may be some that could easily have slipped through the cracks. So that's another bonus to having your Patientcare.
Most definitely. Fantastic. Thanks, Linda. So that's our 4 easy steps with our optional 5th step that is delivering a lot of results to existing customers. If you do have e-appointments or or whatever your booking link is set up within the Patientcare workflow, and you've got that final step included, you can pick up a lot of those rebooks that might potentially slip through the cracks for whatever reason, and you can make sure you pick them up as another avenue to get those reappointments back in. So we've got our aftercare first step, managing any responses that can come through, and that's really the only manual part of the whole process. Is if you get a specific question related to that patient or a concern that they've come back to you with, and that's managed through the platform. And you have some quick responses available to you in there that you can just send with the click of a button, or you can type out a little response that will automatically get sent to them. And then we move on to our feedback step, where we say, okay, your aftercare, we've established that the patient is fine and clinically they're okay, and then we move on to feedback, asking for some feedback on how did we perform. And then from those happy and satisfied patients, we ask for a Google review. And that workflow has, Linda, we've discussed this before. It's got a lot of research behind it, a lot of trial and error behind it by the follow-up team, and delivers really good results when executed and set up as intended.
Yeah, and on that note, Kath, we've had a question here.
Yeah.
Just to say yes, we do send it to every single patient for every single appointment, every single time. So if a patient walked in today and had an appointment, we'll send a reminder tomorrow. If they come in next week, we'll send the reminder. The reason for being is that their experience today may not be the same as what's going to be next week. And I've seen this happen where someone's given a glowing review one day, and the next day go, oh God, you guys were up to par this week. And so it enables you to even keep a track of you, because they said you're wonderful one day, it doesn't necessarily mean you're wonderful the next day. So it's keeping you on track, checking it. But I know someone's going to ask, and I'm going to get in there beforehand. If you have a situation, say, for example, you've just done a big, long sedation appointment and you would like to personally call, you don't want to send an SMS message, we do have a feature available that enables you to actually say, no, don't send that message for that particular patient because for whatever particular reason. It's not one that we strongly recommend using all the time, because we feel that the more messages you send out for aftercare and feedback, the more feedback you'll get and the more responses you get. If you start selecting who you want to send the messages to, it will reduce the response rate down for you. Okay.
Fantastic. Thanks, Linda. Okay. I'm going to keep going with this slide, Linda, if you want to have a look at some of the other questions coming through. which I think may be answered in this discussion here, but we'll see how we go.
Yep.
Okay, so before we answer, Tina, we've got your question there, and Danielle, we've got your questions there as well. We'll come to those in just a moment. Linda, if you can just pop up a poll now, and the question we're going to ask is, what kind of aftercare or treatment follow-up do you currently provide? And we've got some multiple choice answers there. And if you do select other, if you could please pop in the chat what that is, and maybe a little description of what that other type of follow-up looks like.
Oh, we're getting a good response rate here, Kath. They're all
Perfect.
busily voting away. Thank you so much, guys. We appreciate being involved, because this is how we get involved in the conversations, when you take part in it.
Yeah.
So the big runner at the moment, at 58%, is they're following up with a call, email, SMS after intensive treatment only. So they're not actually contacted.
And that is kind of expected to be the norm. It is absolutely impossible or unrealistic to expect that you're manually following up with every patient. It's just not possible, and it really hasn't been possible before this automated system has come to the market, which is fantastic because of the many benefits that we're going to go through that comes with the ability to follow up every patient after every visit. All right, so we've got a couple of people who've said other as well, and we've got all treatment followed up via call, accept reviews, post-op appointments. Thanks, Danielle. And then we use Patientcare for surgery cases, and currently using other system for other calls. Okay, so that's fair. That's everyone kind of is using what's working for them at the moment. So let's see how Patientcare does this and why it does it in the way that it's been set up. So now that we've answered this poll, if you're manually calling up, it's interesting to sort of think about how long or how much time staff are currently spending on post-treatment patient care, and how that can, how some of that can be automated where necessary. As Linda mentioned before, we've got a lot of people who still like to follow up personally on the phone with those high intensive treatments that you want to speak to the patient, you want to make sure they're sounding okay on the phone and that kind of thing, they've gotten home okay or whatever that your process is around that. But some of those, if you like, can be some time saved during that process where it's kind of midline and you say, okay, well, a text message would be perfect for this scenario. And the other question I want you to ask or just think about at the moment is for the patients that you do follow up with post-treatment care. It's very difficult to still hit all of those patients and spend adequate time with them. So if you can save a little bit of time here and still follow up the ones and save time that you've saved there and follow up with the ones that you want to spend a little bit more time on the phone with. So a time-saving benefit is one of the main ones for our patient aftercare, but we've got a whole bunch more that we're going to discuss now that makes aftercare important. And dental practices, you're all staff that are aware of the benefits of aftercare in general. So we're just going to really quickly touch on these points. We don't want to be preaching what you already know, which we know you know. But it's very important to understand that patients' perception of pain can be less severe just being able to express it to someone, and specifically the practice. And that's a psychological thing that has been backed by a lot of research that has helped us develop the way the questions are asked and the workflow in which they're asked. So just touching base, asking, are you okay, can psychologically reduce that perception of the pain. And then once your patients leave the practice, the next time they're likely to hear from us could be from a recall, come back and visit us, or to ask them for a review. So it's really nice to just check in before those touch points and say, how are you feeling? We just wanted to touch base after the appointment and make sure you're okay. And that's putting them psychologically in a better mind space to A, book their next appointment, or B, leave you a positive online review. So why should we follow up after every appointment and every patient? And this, I think, was this was Tina's question. Oh no, this was a question. Oh, Karen's question that Linda did touch on. So the benefits of following up after every patient or every visit is that you can pick up on those unavoidable issues that may slip through the cracks and potentially keep patients that you may lose without realizing before their next follow-up appointment. Patients that you don't really have to lose just by touching base once with them in a really simple automated way.
Yeah, and the other
yeah.
to add on to that, Kath, because we had
Yeah.
someone say that one of their hairdressers said the customer complains about having feedback over every appointment. That's all to do with doing patient education, which we're going to do a little bit further into the webinar to let them understand why you're doing it. And so we'll cover that in a little bit more detail. Hopefully that will help patients feeling like we're not just messaging them all the time just for the sake of it. There is an actual reason behind it. So yeah, we're going to give you some tips and education on that further down. We can keep that one going.
Most definitely. So that is I'm just making sure we're answering all the questions that are coming through on both channels.
Yeah, the one that's sort of come up with the Google reviews.
Yeah.
The interesting thing is we do send the aftercare message out, that then when they do the feedback, they're prompted to do the Google review. If they come back and they actually give you feedback, so this only happens if someone responds to that message, and obviously they will only get the link if they responded to a feedback. So you'll get there. We do have the option that we've got the suggested replies, and one of them is saying, thank you, your feedback's been fantastic. We really appreciate it. And we're just reminding them again, could you give us a positive review on Google? So there's another option to sort of reinforce them to do that message that they come through.
Yeah.
Some are asking, do we know if someone's already done a review? Unfortunately, we don't have the knowledge of who actually is doing a review. We can see when reviews are coming through, but we're not sure who's actually doing that review. But I don't think it hurts just by asking people. And once again, it's all part of the education. If they know that's coming, they just ignore that link if they've already done a review when it comes through.
Yeah, it is even though it's not available in dental yet, you as consumers and customers of other services will have noticed that there are other services that provide similar follow-ups to whatever experience you were attending, and you receive a follow-up that says, hey, just checking how did we do? And that's kind of the feedback component of this workflow. But because this is sort of healthcare and there's a clinical aspect to it, we've got that initial first step, which is the aftercare, and then we move into that more common or commonly known workflow of feedback and review, which people are used to. Your patients will be used to from all the other elements of their everyday lives that they're receiving these communications through. So it's not a completely new concept to them. And as Linda said, if they've already left a review and then they're not wanting to leave that review, but they've just provided feedback for that particular visit, they're just likely to ignore it, which is, there's no negative there from the patient. If they're prepared to leave you a positive review, positive feedback, give you that positive feedback, it's unlikely that they're going to be put out by an additional follow-up message that says, hey, that's great, thank you for that, can you leave us a Google review? It's more likely they're just going to ignore it. We haven't had any feedback from practices so far that have said it's too much, and those that have known their patients or have wanted to do their workflows in a specific way have tailored the system in that way to factor in for their own practice, their own patients. Okay, so we're just touching on any other concerns at the moment. So Linda, have we covered everything? I just don't want to miss anyone's questions as we're going.
I think we've basically covered everyone's in a
Okay.
nutshell. That one, yeah.
Okay, perfect. So we can move on.
Yep, we can move on, Kath. No
Thanks,
problems.
Linda. Okay. So we've got our personalized aftercare. Our next step is feedback, or patient satisfaction, which feedback comes down to. So we're just going to pop another poll quickly up, Linda, please. And we just want to know how you're currently collecting your patients' feedback. Are you SMSing them a survey link that you've got set up after every appointment? Do you have it as a paper form? Are you verbally asking them how did your appointment go when they, when they're in the checkout process, and getting a little bit of verbal feedback that way? Is there another way you do it, or are you not asking patients for feedback, which is also quite common?
Yeah, once again, thanks everyone. I love these guys that are participating in our
Yeah,
polls.
fantastic.
So I feel like I'm doing a race. The one that's winning at the moment is verbally. It seems like a lot of people are just getting verbal feedback at the moment. Around about 58% of them are doing that. We've got a few that send an SMS link. Only about 5%, and about 5% do paper after an appointment. Others do 16. So if anyone can let us know what your other is, that will be good. And then 15% are not collecting patient feedback at the moment. So, but our verbal is the one that's hit the jackpot on this particular one. Yeah, 60% have just done it verbally. Yeah.
Fantastic. All right, you can end that poll, Linda. All right, so now that we've answered that poll, I can see there are a couple of questions that we haven't answered, and I promise you we will come back to them as soon as I get a chance, and make sure I'm going to leave everything open, all the questions open, and make sure we get back to them before we finish up. So, okay, for those that do collect feedback, some questions to just ask yourself at the moment, or just have a think about is, what's the quality of that feedback and how do you measure it? And what are you doing with that feedback that you collect? Do you know which of your staff your patients love, and do you know why, so that maybe you can replicate it across the board? And do you know what your patients like about their experience and what they don't like about the experience? And they can be like little quirks and little things about anything about the practice experience or interactions with staff. And then the important thing is, what are you doing about that feedback? What are you doing with it? And then for those who aren't collecting feedback, how do you know if your patients are satisfied with their experience? And if you're going to say they just sort of tell us, or we have a conversation about it, that's that verbal feedback option as well. So you are collecting feedback, just in a kind of unofficial way, and a very casual way, which is still great. It's very important to know how things are going in terms of the patient experience at your practice.
Yeah, and also, Kath, it's great getting the feedback, and I think it's fantastic. We all love reading. We all love reading feedback, but I think it's really vitally important, and we've got this in patient care, that you respond and thank people for feedback. Because if you appreciate the time that they've taken to do the feedback, they're going to keep giving you that feedback. But if you just ignore them, they go, oh, they didn't even acknowledge that I did the feedback. What's the point next time?
Yeah, that's important.
So, and we do, like I said, we do have that ability in patient care. If they do feedback, we've got it, suggest a reply. You don't even have to type it. We've got it, say, thank you for taking the time to do the feedback. So we've actually got that there ready to go through with it. So I can't stress that often enough, because I know myself, you do something and it's nice to be thanked for it. And then they go, oh, good, I feel good. And then they feel
valued for taking the time out of your day to give it.
And then they'll come in with this, hopefully a skip in their walk, or whatever the term is, when they come in for the next appointment.
Yeah.
Oh, they thanked me for my feedback. They appreciated me, and they may just may have a different perspective when they come in.
Definitely. Yeah, definitely. So just quickly, some of the benefits that are immediate when asking for feedback and getting that feedback from your patients is you get visibility into every staff member and their performance. You can build up team morale when you get really great feedback back from patients. Patient care helps you ensure consistent level of care across the team, and it holds all team members accountable, because at any point they could be receiving feedback in that follow-up message, at any point in that journey, from when they arrive at the front desk and they check in to waiting in the waiting room, chair side with the practitioners, and then the checkout process as well. You're going to get feedback across that whole interaction at your practice, which is really, really valuable. You can compare clinician satisfaction if you so wish, and then you can help them improve the level of care or the way that they're caring. And as I said, keep it consistent if you're trying to maintain a certain standard across new practitioners coming into the business, or improving existing ones as well.
And that's a good point, because one of how Tracy here brought up good point that if you're taking it verbally, are you writing down notes in the patient file? Where with the patient care, we do have an analytical dash area board, and you can actually download the feedback that the patients had given, and you can actually even put it in order, so you can actually see what is the most common thing that they were getting feedback on. And when you're even looking at the negative, hopefully majority of people get good feedback, but if you get that negative, is there a common thread? And you can actually have that is seen in patient care, but you can actually export it into a CSV file, so an Excel spreadsheet, so you can actually start really looking at it and seeing how can we work on that feedback. Yeah,
that's fantastic. I wasn't going to say that, so that's great. So they're the benefits of asking of receiving feedback, but for your practice. But in terms of the patient, Linda did mention this, they get an opportunity to share their own experience after every single visit, and it's not going to be the same. It's not going to be the same feedback after every visit, so you do want to be getting separate feedback after every visit, because different time, different staff, different years, a lot can change visit to visit. And you're also giving your patients an outlet to express any negative concerns or any concerns they have before they take it upon themselves to go to Google or go to another online review platform and leave a review. That way you're catching those negative, those unsatisfied patients before you lose them, and before they start telling others about that negative experience. And you get a chance to address it, resolve it, and turn an unhappy patient into a really satisfied one that's going to come back to you and even sing your praises outside of the practice before their next appointment. Okay, so have we got any questions that have come through regarding patient satisfaction or asking for feedback?
Basically, we've got one here that's an interesting one. We want to know how many SMS are sent to the patient in total.
Yep.
Okay, so we've got a few different options within patient care. We generally, when we start off with patient care, we always set you off on what we call our generic journey, which is just a simple one SMS that we'll send, which will have the aftercare and the feedback all in one message. We found people respond quicker to that one, so we can send it off in one SMS that we can have. Or you can do the option and say, no, I want to do aftercare one day and then the feedback the next day. Or you might say, oh, I actually want to get more information about a particular treatment. So we do have it broken down that we can send SMSs or aftercare responses for particular treatment, and that we can actually tailor. It gets tailored. So for example, if you're doing, say, an extraction, we might send an aftercare message on day 1 just to see how they're going, send another after day message in day 3 just to make sure we haven't got any dry sockets or anything happening at that point, and then on day 4 we'll then go for feedback. So you've got that option there if you think that would suit your practice better, or you can simply just send the one message like we have and just have a very simple message, which a lot of people tend to stay. It's very simple, and then that's what we send out. And then depending on the patient communicating with you, Depends on how many messages would come back. Because often we'll say, thank you for your feedback, and they'll come back, our pleasure, that sort of thing. So there is, it's no set rule of exactly how many SMSs would go out, but we do have different communications that we can send out to them.
Fantastic. Okay. All right. Still got some live questions we're going to come back to. All right. So reputation management is sort of the third pillar in our three-pillared approach to patient care or patient aftercare. So our last poll in this section is going to ask you guys, how do you ask for online reviews? Specifically, are we doing verbal requests after every appointment? Are we emailing or SMSing all patients every now and then, like a big batch send? Is there another way you're doing it, or are you not asking for online reviews at the moment?
Okay. Oh, gee, we once again, everyone's in there giving us scores, and like again. So we're looking like the highest response rate we're getting here, Kath, is they don't ask for online reviews.
Yeah, and that's okay.
Yeah.
I mean, that's common, and we'll have a chat about why it's important to have a good online, positive online reputation and how to achieve that now. Okay, looks like that might be everyone. We might close the poll, Linda. So that's really interesting. Thanks everyone for answering. So this is the thing to think about directly after that poll. And the question is, do you currently have a strategy for how to improve if you have a negative online reputation at the moment, or not so great? And negative, by negative we could be saying anything below a 3.7 Google star rating. Do you know what your star rating is on Google? Anything below 3.7 is negative. Anything below 4.2 is average. You kind of want to maintain above a 4.2 star rating, and anything above 4.7 is great, is thumbs up. So do you have a strategy on how to improve that or maintain that positive online reputation if you are a 4.7 star rating with hundreds of really great reviews? How are you going to keep that up? Because that last review dates, the next day, a week later, 6 months later, you need to keep that influx of positive reviews fresh and current. All right, so.
And something to look at with your Google reviews too, this is a little tip I learned along the way, is people have an expectation on what their Google reviews would be. But one way to find out on how many Google reviews you can possibly gain is actually look around the other businesses in your area and see what their Google rating is and how many people have put a Google review, because that gives you an indication in the demographic or where you are. Because a lot of dentists will obviously, patients usually go to people close to them, and so they will be looking there. So if you go in and say, oh, if only the coffee shop down the road is only got 99 responses, the chance that you could be in that, they could be that particular area doesn't do a lot of responses. If they're a little bit higher, you might like to go. And I have tested this out. I've gone in and I've just randomly picked dental practice. I don't know them from bar or soap, I just picked them randomly. And then I just went, okay, where are you located? And then I had a look. And so, for example, I saw one
in the area.
Yeah, other businesses. And I did it for two. I did one. I looked at it and they had a medical practice in the same location. I thought, well, this is a good one, sort of
nice comparison.
Yeah, like comparing oranges to oranges. And the amount of responses were about similar for what the Google reviews were. So that was a case, but interesting, a dentist was doing very well with very good responses. The medical weren't doing so too greatly because it sounded like a lot of their patients were actually going to Google reviews while they're waiting for an hour in the patient lounge to tell everybody, I'm still in the patient lounge, I haven't been removed, blah, blah, blah. Another one too is if you're new to an area too, it could be new. I did this for another practice that I just randomly picked in a different state, and it was new. in a new location. And so I compared it with the coffee shop, because that's where most people will do a Google review on the foods.
Yeah.
And they were still a bit low. So it was looked like it was an area that was building up. And so it might slowly build up your Google reviews. So you need to sort of just assess in your area, are people prone to do Google reviews? Is it a demographic that does do Google reviews? So don't expect you're going to get 200 if that's not the realization of that. And this is when to Google reviews too. Is don't think, oh, good, now I've got patient care, I'm going to get, my Google review is going to increase by 1,000.
Yeah.
Well, if you're not seeing 1,000 patients to send 1,000 messages to, realistically, that you won't get the Google reviews. If you're only seeing, 2 patients a week and sending a message to week, then you're not going to get that 1,000
volume
reviews. Volume.
The volume is directly correlated to how many you're going to send, and that's going to come back to how many you're going to receive. And something important I just wanted to touch on that you mentioned, Linda, as well, is that patients are more likely to see someone in their area. It's more convenient. But if people are looking online, and they are looking online at someone's reputation, a business's reputation, and what others are saying about that business, and if someone's got a negative star rating, or there are negative reviews that haven't kind of been drowned out by positive ones, they're going to travel further for someone with a positive online reputation. And that's really important as well to your influx of new patients if you are relying on those digital sources as well. So I've got some things I wanted to share as well before we move on, specifically about patient care and why it achieves really great results in terms of Google reviews for practices. Apart from extending touch points out and then leaving your patients in a better frame of mind, you've got happy patients, you've got satisfied patients by the time you're asking for a review, so you're more likely to get that compliance to leave you one and transfer that positive feedback that they've just left you in the step before online to the public. Most other feedback or online review management systems focus specifically on the reviews and just directly asking for a review after an appointment. Why patient care is different is it's asking your patients, how are you? Before, how did we do? And before, will you talk about us positively in public? So that psychologically places the patients in a better frame of mind to leave you that positive review. And Google reviews become an organic result of those previous steps and overall what the service does. It's a very natural way, and it feels a lot more natural for patients. They don't feel like they're being marketed at. They really feel like they're being taken care of. And as a thank you, they're leaving you a Google review. There was one more thing I wanted to say. Yeah, that was the star ratings, which is really important to remember. And the last date of the last review is also a very important thing that people and patients, consumers are looking at when they're trying to find a new service provider as well. Okay, did we have any other concerns or questions come through, Linda, from this section?
No, I think we've answered them all.
Yeah, we'll do a quick review at the end to make sure we've answered all questions, but we're going to press on, just slightly behind time at the moment. All right, we want to touch on security now, which is really important in today's day and age. Patient data security, staff access to the system, patients responding to text messages on their phone with links and things like that, and what patient care does to sort of ensure security around patient data and make your patients feel comfortable in responding and clicking on links in text messages. So, Linda, do you want to just touch on staff access, and then I'll go through the rest of them?
Yeah, so you do have the ability in patient care to only give access to certain patients, staff to access patient care, just like you do in Dental for Windows. You've got that ability. You can set them up with a particular role. So if you've got your practice manager, you can have her or he or her set up to have access, and you can have them set up that they don't get the necessary alerts, but they've got access to go in and look at the analytical dashboard, look at how it's performing. And then you can actually set up your reception team on a reception login, and then they can log in to be able to look after those particular messages. So you can give it to everybody in the practice to have a look at, patient care if they want, or you can select who you think on the team would be the best one to go and respond to the SMS messages and only give them access, and that can be easily set up.
Fantastic. All right, so on educating your patients, this is a really important thing that you as a patient care user need to be doing. And doesn't take a lot of time. It's just at the end of the appointment, mentioning to your patients, hey, expect this text from us. It's going to come from us. And that's where we link into alpha tags, which is, your unique sender ID, so that when they receive a text message on their phone, it's from your practice. It can be from your dentist name, it can be from your dentist or your practice name. And so the patient should expect it to come to their phone with a link that is safe to click on. So it's all about telling them about it, expecting, setting up their expectations to receive it and what you expect them to do. And I've got some tools that you can use on the next couple of slides for educating patients. So we'll dive into that again. Patient care allows you to use alpha tags to send those text messages, which is also really important in terms of fraud detection and patients being able to identify scans on their phone coming through. It's important to let them know about the text coming through, but alpha tags also gives them that added level of confidence that it's a safe message, it's safe to click on, and fill out those or answer those short questions from you to check if they're okay. In terms of patient data, from the practice, your patient data is transmitted securely to a Sydney-based Microsoft Azure servers, where the data is stored and maintained under the highest security standards and conditions. No patient data leaves Australia, and only as Linda mentioned, your authorized users have access to the patient data on the patient care system. It's not shared with anyone, stays in Australia and doesn't leave the patient care environment itself. The practice, if you are a current user and you decide to stop using the service for any reason, all your data will be permanently deleted within 30 days. And we have that 30-day buffer so that if you decide to come back online, we've still got all that previous data there, but after 30 days, it's all permanently deleted. Okay, any questions around security before we move on? We've got one in our chat, Linda.
Yeah, we got here alpha tags for multiple practitioners or just for one. Normally, it will be for the practice, the alpha tag, because it's there's a lot of we've got to register the alpha tags now, and there's a lot of data we've got to do. So if we're not registering,
from patient care itself.
Yeah, so you need well, it's a legislation that's come in as part of the safety guard for the scams, so that now alpha tags have got to be registered, so that now when a provider, the patient's provider, sees an alpha tag come through, if they know it's registered, they're safe to say, yeah, we can put this message through to that patient. But if it's not registered, it won't. So at the moment, it basically will be for a location, the alpha tag that we'll have.
Yeah, that is correct. All right. We haven't got any other questions specifically around security. I'm going to move on to some patient education around receiving the text message really quickly. So in terms of educating your patients, we've got these 4 steps here that you guys can follow for those existing users. The first is to inform, let your patients know about patient care, the first step. And you can say something like, I wanted to let you know we have introduced a new service to our clinic, and it's called patient care. Use the name patient care because that's what they're going to see when they click on the link to fill in each of those steps. Explain to them what it is and why you've implemented the service. We've introduced this so that we can continue your care beyond today's appointment, as your oral health and overall well-being is important to us. We want to check on you. Describe what's going to happen. Outline to your patients what they should expect. You're going to receive an SMS or an email, because we can do this via email as well, from us tomorrow around 9 a.m. with a link to answer a few questions about how you're feeling. To ensure that we are maintaining a high standard of service, we're going to ask you for some feedback after you let us know that you're okay. And then set an expectation with your patients on what they should be doing. Reinforce the need for them to answer and respond to the SMS or email. We would appreciate you taking just 1 minute of your day to respond so we can know how you're feeling. Simply click on the link and answer the short questions.
Yeah. So with this one, Kath, this leads back to our question we had before about the hairdresser, the patient complaint. This is the education. Yeah. And this is the one where I would try and make it as exciting as is possible. So much so that the next day when they say, oh my God, this is what they're talking about. I can't wait to get in and have a look at it. So you really get it involved and you really make it, put some passion behind it. We've got this because of you. We want to see how you are feeling. Make it very centered to that patient and why we're wanting it, why we want the feedback, and really get them feel like they are part of the team. As I said, patients pick dentists because of emotional contact and they're feeling that emotional connection with you and they want to go on that journey with you. They'll hop aboard. So I really would be very passionate and just you'll get to the stage, it'll just come out of your it's natural to come out of your mouth. You do the payment and next minute you've got their next appointment booked and say, you give them that bit of a wink and say, guys, looking forward to hearing what you've got to say tomorrow. But probably don't be that cheeky, but you know what I mean? Just get in there and get them on board and say, look, we really are, you are our number one concern. And this is,
and that's really, you made an interesting point, Linda. If you make it seem like it's part of the service that they're actually paying for as well, it's just extending beyond the practice and beyond the chair, you're likely to get some really good response rates to that initial aftercare message as well. Feel free, as I said, to pop in some questions here. I'm gonna move on. We've got some content that you can put up, some signage you can put up, because they will be seeing the Patientcare logo on the platform on their phone when they go to fill out those questions. It's really important to get them familiar with that branding as well. That's what they're going to be seeing. So we've got some patient-facing signage that you can put up, and then we've got that. We've got that previous slide where we've got some, tips for staff, for reception staff on how to talk about patient care. So if you would like us to send you this content, we can do that. Just let us know at the end, or any time in the chat, and we can have that sent out to you for existing users. But essentially, it's the same kind of language used as you would be saying to them verbally, reinforcing them to look out for an SMS that they should receive the next day from your practice.
So this signage is not only good for educating your patients, but as we all know, anytime you have a new service in your practice, you want to get your whole team on board, because we know as the patients journey through the practice when they're there, they speak to many of us. You've got receptions, dental assistants, dentists. So if you get everybody on board and they all know about this, if the patient happens says, I got a message over there. Oh, did you? Oh, did you respond? Because that's how they can continue that education. It doesn't have to be totally relied on by the reception team. So you could use this material that Kath's got here for in a huddle meeting or a staff meeting to say, guys, we're introducing this, get the team on board. Once again, educate them why you've got it at the practice, why is it important, how easy it is to use. They don't need to go, if they're not responding to the patients at reception, they don't need to know it in detail and have the necessary training, but they need to know it so they can then reinforce and just follow that message throughout the whole patient's journey whilst they're at the practice.
That's right. And something you mentioned to me multiple times, Linda, when you're doing your onboarding sessions and your follow up with your training and checking in with practices that are using this, that are using Patientcare, rather, is that those that are sort of invested in patient education are the practices that are getting the best results from Patientcare. They've got the biggest response rates or the highest response rates coming through, and then as an organic result of that, they've got the most Google reviews coming back and the most positive feedback coming in. So it really stems back to getting your patients on board with this new service and educating them early to, from the outset of using Patientcare, getting them responding back straight away. Okay, so essentially the service Patientcare is all about putting your patient first. You're delivering a great service to them while they're in the practice. You're going to get that good feedback, and then you're going to get that positive Google review every time without fail. If you're delivering that great service, you're getting that feedback, you're going to end up with a positive Google review. So that's really important. You're not leaving any patients behind with this process. You're making sure you're checking in with all, and you're gaining as many reviews as possible by implementing this workflow in this way. Any thoughts on this, Linda? Are you happy for me to keep pressing on?
Just basically the old adage, you value me, I'll value you. So if you value the patient, they're going to value you. So it's, it's a give and take. You know, if you want to take, then they'll take, but they won't give. So you want that bit of give and take. I'll give you that great service, and can you give me that great feedback? And
right.
And just you and the patients are a team. That's and try and keep it as a team. Yeah.
Fantastic. I've got a little slide here. I'm gonna get through this really quickly, but essentially Patientcare is great for everyone in the practice. For the reception team, it's saving them time. They're spending less time on the phones, and they're doing less manual work. For the practice manager, you're motivating your team with great feedback coming through. You've got to really efficiently run practice because you're automating a really time-consuming task, and you've got consistent communication going out to all patients. For your practitioners, they're receiving really valuable feedback to improve their service. They're reducing post-treatment complications by early detection of the issues, getting to patients fast, and then saving time, saving resources and energy later by detecting those issues early. It's a really important one. And then they have the ability to compare their service and their treatment against their peers, based on patient feedback, of course. For the business owner, you're increasing patient retention, you're improving patient lifetime value, you're building a positive online reputation, which is very difficult to actually achieve without an automated service like this. And you're staying competitive in a really saturated market as well. Online is where people are looking to assess whether they're going to spend their money and their time with a service provider. And you've got consistent patient experience across your practitioners. All right. So I've got some other common concerns. We may have already covered some of them, but I'm going to share them because these things have come up a lot with Linda's sessions and with our chats with practices who are interested. So you might have been thinking it, haven't just asked it. So we're just going to quickly touch on those. I think we have done the first. I don't need to follow up with every patient, or I only want to follow up with certain patients. So I guess the type of thing that we respond back to and what we feel about Patientcare is, if your patient has a poor experience, wouldn't you rather know? And the only way to make sure you know is to follow up with every patient. If you're not following up with every patient, is that simply because you don't have the resources to, which is very understandable.
And the one thing I will say too, don't assume.
Yeah.
Some people say, "Oh, I'm not going to send a message to them. I think it's going to be negative." Don't assume, Because sometimes that grumpy old person that's walked in the door that drives everyone nuts, and every time you see them in the appointment book, you roll your eyes and go, oh, here we go, may turn around and give you a fantastic feedback, because that's probably them reacted to being at the dentist. But when you ask them their feedback, when they're at home, cozy with a cup of coffee and relaxed, oh, I think they're wonderful, but doesn't know how to show that when they come to the practice, because there's nervousness all get up and don't know what to do. So don't assume, because the old adage, don't judge a book by its cover, because you don't know what feedback. The person that you think you just had a great experience with, I will tell you, turn around will be the one that may likely give you a negative. And I've seen that many a time. You come out of a treatment, and you think, oh, gee, we got on really well with that patient. And next minute you're getting a complaint and you go, gee, that's, you got those two-faced type people. So you got to, by getting out there and you're going to get a true reflection of the feedback.
Absolutely. All right, our next one is, I'm concerned about spam rules or APRA guidelines on requesting reviews. So Patientcare is fully in line with the Compliance Act. The is fully in line with compliance of the Spam Act. So it is definitely allowed in terms of how we ask for reviews and how we ask for feedback. So it sits within all of those compliance restrictions. It's just about what we do with those reviews as a practice and where they're displayed. So you are allowed to ask a patient for a review, but it's just, you're not allowed to use that on a website controlled by you, so your own website. But Google My Business, for example, is not something you can control. You can't delete a negative Google review, and so you are more than allowed to host reviews of your practice on Google, and ask for Google reviews as well, just not your social pages or your website. We want to call our patients ourselves, is a common one that Linda and I receive. Essentially is, do you have the time and the resources to call all of your patients after every visit? But those practices seem to also have a really strong focus on the patient experience, which is fantastic. It's exactly why this service was created. And this allows you to get feedback from all your patients about every aspect of your service. And it makes it really easy to transfer the role of managing feedback and reviews to other staff when you have existing staff who are managing that manual process, and they go on holidays or they leave the business, or they're off sick even just for a day. You can be sure that this process and this automated workflow is going to keep ticking on, no matter who's responding or who's there managing that process as well.
Yeah, because a lot of them will have said is that I don't think the SMS is personal enough. I think we could do by the call, but it is. Sometimes it gets to a stage where you're doing the call because it's just tick a box. So you're calling and go, oh yeah, I just want to see how you are. So are you still giving that, personal touch without you knowing it? That's right. But also there's nothing stopping you from actually sending the initial SMS message to see how they're going, find out what the response is, and then you can get on the phone and say, and like I said, you can then say, I'd like to talk to you in more detail. They're prepared for the phone call. A lot of times, if you call them out of the blue, they could be in the middle of the shower or something like that, because everyone's attached to their phones. They want to answer them all the time, and they could be in the middle of doing whatever. Have you got their full attention? Whereas if they've got an SMS, they're usually going to open it because they've seen it. They will want to look at it, and like I said, if you need to talk to them, you can prompt them and say, is it fine to call? And then they'll be prepared for your call, and then be prepared to talk to you about whatever needs to be. So there's still that personal connection there, but you are going to hit more targets by doing this SMS than probably trying to call, because how many times will you start at the beginning of the day and you're still trying to contact some of the patients at the end of the day because they're leaving their voicemails are on, or if it's, if you're like me, if a mobile number comes up, I don't know about it. It goes. I don't even bother answering. And if you don't leave me a voicemail, I'd sit there and go, no, I can't be bothered. If you didn't leave me a voicemail, I'm not going to call back. And so it's all that sort of thing there.
Yeah, definitely. So we've gone over in detail value in obtaining feedback. So I'm not going to spend any more time on that. And then I don't see a dramatic increase in Google reviews after 2 months. I mean, in Patientcare, we've seen results that have seen practices get a boost in Google reviews after the first month they've used it. But we have also had practices say, I don't see a dramatic increase. Well, what's dramatic? Are you receiving 4 or 5 new reviews a month? That is dramatic in terms of Google reviews and the Google review platform. So it's all about expectations. If you're getting 4 or 5 new reviews a month, that's fantastic. That's going to be enough to sustain a really positive online reputation that's ongoing, and you'll see your Google star rating start to tick up point by point. Linda, do you have it? I'm going to go through the questions now.
With those Google reviews too, you've got to build up that relationship with the patients, because realize you've just brought in a new service for them that's new to them. Yeah, and so they're getting used to it, and as they get used to it and they know that it's going to happen every single time they come in, you'll build it up and they'll go, oh, okay, I'll do a Google review now. It might take a while for them to even say I'll do a Google review. You might have to prove to them that you're worth that Google review after a while. So after a while, if they keep coming and you keep giving that great service, they go, well, I'm going to give the Google review. So it may take a while to build it up and build up, the patients being involved in that process.
Definitely. All right. So that is our last slide to go through any content. We're going to open up to any new questions. Now, before we wrap up, we've gone 10 minutes over, so I do appreciate everyone's time who is still with us. And if you have any questions, throw them in now. I'm going to work through them really quickly and answer as many as we can. So Danielle asked this early on, out of curiosity, are there ways to follow up on patients who have received a Google review prompt and have not yet left one? Say you feel that they are very eligible, happy candidate for a review, but a second or third prompt is the one that's going to get them to respond. So with the Patientcare workflow, it will ask for, after every appointment, at the end of that 4 steps for that Google review, but that will be the last request for a review after that particular appointment. They come back into the practice, they're going to go into the beginning of that process again. It's a new experience, it's a new visit, so hopefully you're going to get that review, and it's all about patient education. So unfortunately we can't resend the prompt for the review. I'm going to
step in. I'm going to step in there, Kath.
Yeah, of course.
If someone does do a feedback, so they have to do the feedback. And that's the only way that they'll get the Google review link anyway, if they do a feedback. So which means then they will do a feedback. So you can prompt someone who's given you a feedback that you think may not have done a Google review. We can send that link again, but we can't send it to someone who hasn't responded. So if they haven't responded, they haven't been interested. So we're not going to push the button there. But if someone you think may not have done a Google review, but they have done a feedback, you can do it. And like I said, with our Google reviews, we do have it set up to say, well, we'll send it to the link only to what we call Google promoters, which score you a 9 or a 10. But if someone comes back and has scored you a 7 or an 8, but the feedback is really fantastic, obviously your judgment call, you might say, prompt them to say, oh, look, you gave us such a really good feedback. Could you give us a positive feedback on Google? And you might pick up another one there. So you can do it there, but you can't just blind feed another Google review, but you can ask for another link along.
Thanks, Linda. Thanks for clarifying that. That's why I've got you here. All right. So how much does Patientcare service cost, Brock? So Linda, if you can pop up the follow-up poll. So if anyone is interested in talking to one of our team about implementing it at your practice, let us know in this poll that's going to pop up now. And that's where you will get service cost for your practice. It's based on certain criteria in the practice and sizing. So you'll just have to have a little chat with one of our team, if that's okay, and we can give you the accurate cost for your practice. And there it is. Perfect. Thanks, Linda. That's Jim. That answers your question as well. Jane, yes, we'll definitely send you that practice collateral digitally. And we've answered Keziah's question. Can you have alpha tags for multiple practitioners? How many SMS do they receive in total? So did we answer that one, Linda? I'm
Yep.
pretty sure
Yeah, we did. Yeah, we
Yeah.
talked about the different communications you can set up. Yeah.
Right. Okay. But generally it's around three texts over the whole workflow, right? But there are different types of workflows or journeys that we can set up.
Yeah, depending on your patients.
Depending on your patients.
Yeah.
Will it flag if a patient has recently visited and filter them out rather than sending to multiple follow-ups? This is a good question, Linda, that I'm going to get you to answer from Zoe about if a patient has an appointment, say, within the next following week or within the following week.
Yeah, no, where we will flag it, if the patient is seen today and they've got another one tomorrow, it will usually probably flag it that they've already had a message sent because it's within a very close point in time. If you see them today and then you're going to see them again next week, they're going to get another message sent as well, because even though it's a week difference, a lot happens in a week. And then, it could be that the first day they came, everything was running smoothly, everything like clockwork. The next week you come in, you're short staffed, everything's running around and things aren't running as smoothly. The patient's not happy that they were running late. So they will be sent that message again, even if it's the week difference, because we want to check, because we don't, every day is not exactly the same. If every day was exactly the same and we were absolutely smile on our face from the time we walk in until the time we leave, and we try so hard to do that, doesn't always happen. And it really needs, to be seen. And if you're finding that the comments are reducing a little bit, then it's a way of you just checking to see how you're performing, because yes, we will do it on those different appointments.
Fantastic. And you can always just turn off if you definitely don't want to send to someone you did see last week and everything's fine and you don't want any feedback about that appointment, you can say do not send to this particular patient after that appointment, right?
And I will stress too, because there's some lovely, I love Patientcare, obviously, but if you do get that one patient, we've always got one patient in the practice that says, "Oh, I don't do anything. No, I don't want to tell you what I feel like. Oh, no, I don't want to tell you how I feel." You can unsubscribe them, so that you've got someone who just doesn't want any communication whatsoever. You can do that, or you can select on one particular appointment not to send a message out. So you do have that little bit of control that you're not going to totally upset your patients. But I really got to stress, if we're educating them and getting them on board with our excitement, it'll make life easier.
They're going to want to participate, right?
Yeah, that's exactly right. Exactly right. Yeah.
All right. Would you recommend SMS for, this is from Katrina Banks, would you recommend SMS for cons with specialist? Cons. Is that something you understand? I'm not sure what cons is.
No, I'm a little.
Comms, maybe comms for specialists. Maybe we're talking like a specialist practice and
consult. Consult.
Right.
You're trying to get us into our wavelength of the.
Yeah.
So what was it?
Would you recommend SMS for
consultations for specialists? Yes.
We can.
You can send it out. I'm just not sure.
Some instances where it may not be the current journeys that are available in patient care may not be relevant or applicable for some types of specific specialists. So just get in touch with our team, Katrina, and we can work out whether patient care is right for your practice or not.
Yeah, it's a tricky one when it comes along with the specialists.
Yeah, we can go through the specific comms with you and really establish, whether it's going to work.
Yeah.
Okay. I think that's it from the earlier on. Perfect. There we go. I'm just going to go right down. We've got a few new ones. Alpha tags. Cost. There we go. Oh, consult. Yeah.
No, that was to do with the conversation we just
Sorry,
had.
I was right
Yep.
at the top. Yes, would you recommend? Okay, perfect. All right.
Yep.
Any other questions, guys, before we wrap up? Thank you for everyone who's requested a follow-up in that last poll. We'll have our team reach out as soon as possible. But other than that, we really appreciate your time in joining us today and your engagement. You've been fantastic and asking all the good questions that we wanted to get to. Covered everything. We've gone a little bit over, so I appreciate you sticking around. Thank you, Linda, for all your patient care specialist knowledge.
Oh, well, thank you, Kath, putting it all together for us. We greatly appreciate it.
Wonderful.
And we've answered all your questions.
I hope so. We will share the recording and some tools with you in a follow-up email after the webinar. Thanks, everyone. Have a great afternoon.
Bye, everyone. Have a great day. Bye.